So now we're going to talk briefly about the synthesis of leukotrienes. And leukotrienes are the third group of eicosanoids that can be derived from arachidonic acid. Again, they have this important common initial step that they share with the other eicosanoids. They need arachidonic acid to be released by phospholipase A2. Again, this is a stimulus-dependent process going through a G protein coupled receptor. Once arachidonic acid is produced, it's going to be metabolized by a new enzyme or a different enzyme, 5-lipoxygenase, LOX. That produces an intermediate called hydroperoxyeicosatetraenoic acid, HPET, which then is converted to LTA4 if you want the parent leukotriene. So LTA4 is an important parent leukotriene that is used to make the other leukotrienes from LTC4 to LTF4. Importantly, these leukotrienes from LTC to LTF are the bioactive leukotrienes, meaning they are the leukotrienes that will have cellular effects. Second important thing I would like to say about leukotrienes is that leukotrienes typically, these guys down here, are involved in hypersensitivity reactions and allergic reactions, unlike prostaglandins and thromboxanes, which are more strictly involved in inflammatory responses. So just quickly here again, LTA is the intermediate, LTB4, and here's all the cystenyl leukotrienes. These leukotrienes are made by the addition first of glutathione, and then you can remove parts of this tripeptide to form LTE4, LTEF. Anyway, all of these from LTC4 down are the bioactive leukotrienes, and they are referred to as the cystenyl leukotrienes. So one important reminder is that cortisol will still have a very important effect here on phospholipase A2. Again, by inhibiting phospholipase A2, you won't produce arachidonic acid. You will not synthesize any leukotrienes as a result. So cortisol can be used again to suppress the synthesis of all eicosanoids. One important thing is that you don't need to know the exact details here about the synthesis of these leukotrienes. Just know that these are all referred to as cystenyl leukotrienes, LTC through LTF4. Finally, it's good. These leukotrienes that are bioactive are an important component of what is called the slow reacting substances of anaphylaxis. Most of these cystenyl leukotrienes are produced during anaphylaxis and other allergic hypersensitivity responses, and then they're going to have various effects on vascular permeability, bronchoconstriction, and vasoconstriction. One such example of the effects of leukotrienes is asthma. Asthma is an allergic response associated with airflow obstruction, increase in secretion of mucus, bronchoconstriction, and infiltration of inflammatory cells of the airway walls. So most of these effects are really due to cystenyl leukotriene production. So treatment of asthma, for example, can involve one of three strategies. You can get a receptor antagonist leukotriene receptor antagonists that prevent the effects of leukotriene on their respective receptor. You can have a lipoxygenase inhibitor, meaning you inhibit the synthesis of leukotrienes in cells, so that's another strategy. The third one, which is more the comprehensive strategy, meaning is the use of corticosteroids, which inhibits the release of arachidonic acid, and that will inhibit the synthesis of leukotrienes as well as prostaglandins and thromboxanes. And this is really a good summary table for some of the things to recall about this icosanoid lectures. Is initially everything starts with the activation of phospholipase A2 producing arachidonic acid. There is one pathway that is responsible for the production of prostaglandins and thromboxanes, and that's the cyclooxygenase pathway. Okay, involves either COX-1 or COX-2. The other pathway involves the lipoxygenase pathway, which is responsible for the production of leukotrienes. There are several important sites where you can inhibit or affect inflammation. NSAIDs are very important regulators of inhibitors of COX-1 and COX-2, aspirin being the most important irreversible one. You don't need to memorize names of the NSAIDs, just know what their sites of action is. They will affect primarily the synthesis of prostaglandins and thromboxanes. No effects on leukotrienes. Corticosteroids can inhibit phospholipase C, prevent the release of arachidonic acid, and the release of arachidonic. Without arachidonic acid, none of the icosanoids can be made. Okay, so corticosteroids is a very potent anti-inflammatory agent because of its inhibition of phospholipase A2. Corticosteroid can also inhibit the induction of COX-2, which is the second isozyme of that is inducible.